We've now moved the client into the lateral recumbent or the side position. You can see here we've supported her head. She's right back at the back of the table, and I'll explain why soon. This bottom leg is out straight and the top leg is bent up as far as is comfortable up towards the chest. I'm going to place a small pillow just under the client's knee, just for a little bit of extra comfort and so that I don't twist the spine too much. We're now going to be working deep into the hip. Now, this can be quite a challenge for your client, so we need to work with the client's breath. There are 3 points that we're going to work here. There's 2 ways to find it. You can either feel for the bony protrusion here, feel for the edge of the sacrum, and you're looking for the middle of it. That will give you your guide. Or you can take the center of your middle finger, place it on the head of the femur, spread your fingers, and those 3 points will be roughly where you're looking. That just gives you the rough idea. You're then looking for tight spots within this hip. Now don't forget, here we're working on the deep hip and the muscles that will affect the piriformis muscle, where that sciatic nerve is going to be trapped. We're putting quite a lot of pressure on here. This can be challenging for your client, so you need to work with the client's breath. What you'll find is there'll be kind of squishy areas, for want of a technical description, and then there'll be areas where you find that resistance. There's usually 3. I say usually because every client is different, and you might find some people only have 2, some people have 4. What we're going to do is work on these resistant spots. Now, if somebody's had a former axial sciatica and they're kind of well on their way to recovery, and their osteopath, their chiropractor, their doctor says they're okay for this massage, you can support the knee much more with a big pillow so that there's no twist, and you can do this work just with your fingers. Realistically, this is just for appendicular sciatica only. This is the safest way to do it, just to reserve it for the appendicular, unless somebody is a long way into their recovery. Having found that central spot, I can feel that resistance there. I'm then going to place my elbow on that spot, and it is the point of my elbow that I'm placing. My hand is relaxed. If I'm like this, I'm putting tension back into my own body. And for those of you who work with energy, you're aiming the client's energy that you're releasing back at yourself. So nice relaxed hand, pointing away, pointing down. So I'm on that point of tension. You can check that you're on the right place, because if you just give a little wiggle with your elbow, your client will respond and you'll know that you're in the right place. You probably can't see Margaret's eyebrows raise on camera, but I can see it as my cue that I'm in the right place. I'm going to make sure I am well grounded. My feet are apart. I'm there so that I know that I'm not going to be off balance when I do this move. You can see I'm not leaning on my client. I'm stepping back from the client. If I need to go up onto my tiptoes, that's fine, because my legs are apart and I can still get that balance. So I'm going to ask Margaret to take a deep breath, and on her out breath, I'm going to press in. I'm going to press in with some depth, and I'm going to hold that muscle. Now I'm going to ask Margaret to let me know when I've gone deep enough. Now she might do that with a wave, with a shout, with the raise of an eyebrow. I will keep my eye out. Different clients will do different things. You can just ask your client to let you know when it's as deep as you want to go. Okay, so I'm going to ask Margaret to take a nice deep breath, and I'm going to go in on her out breath. Just going to there. And Margaret's nodding at me that that is as deep as she wants me to go. I'm now just going to hold this point. I'm not going to apply any pressure. I'm not going to move my elbow. I am simply going to stay statically on this point. Margaret's breathing well. If your client doesn't breathe well, encourage them to breathe deeply. I'm just holding that point. And I'm looking for that feeling underneath my elbow when I feel that muscle relax. It's just starting to relax now. It takes on average 30 seconds to 40 seconds, but it can take 2 or 3 minutes where you just have to hold that one point, not move, not wiggle around, just stay static on that point. I would then ask my client, does that now just feel as though I'm leaning on you? I'm getting the yes. So, and I'm going to come off slowly. You can see I lift my body before I lift the elbow. One of the worst things to do is to then push yourself up using your elbow and you add pressure back onto the client. So just make sure that your moves are slow and deliberate. Now, having done that center point, I'm then going to come down to the bottom point. You can really do these in any order. I find that by releasing the center point first, you will get a quicker release. So I'm coming down to that middle point. Remember, it's this finger. But you can just feel for where is soft, where is resistant. Use my elbow again, same thing, relaxed hand. And I'm going to ask Margaret to take a nice deep breath. I'm going to go in on her out breath. And again, I'm going by Margaret's facial expressions that is as deep as she wants me to go. So you can see I'm not leaning on the client, I'm supporting myself with my other hand. You'll need to watch your table height with this. If you have a larger client on the table, you might need to put the table down for this so that you're not up on you're kind of very tiptoes leaning over onto the client. So you're being aware of your own body as you work as well. Now that resistance has just gone in the muscle, it's just nicely melted away. So again, I know that I can come up and release. We work on the final point. If your clients slip forward a bit, just ask them to come back up. So I've done the middle one, I've done the bottom one, and now I'm doing the top one. Be careful with this point that you don't slip forward. You are going straight down. You're not moving your arm forward. If you move forward, it will be very uncomfortable for your client. So get their feedback. It will feel different to the uncomfortableness of the other 2 points. It will be a sharp pain and it will feel wrong. So just get your client to give you that feedback if it's wrong. But so long as you go straight down and not forward, you should be okay. So again, I'll ask my client to take a nice deep breath. And with the out breath, I'm just sinking in, taking my cue non-verbally from Margaret to stop there. And I'm just holding that point. If you've got a really resistant muscle, I can feel it a little bit in this side, you will find that the muscle kind of wobbles a little bit, it vibrates a bit underneath your elbow. Just hold it. Don't go any deeper, don't take any pressure off, and you'll find that subsides quite quickly, and then the muscle releases. And again, we come off slowly, bringing the arm off without putting any pressure on the client.